Hello, everyone, and welcome to my channel. Today we'll be discussing stasis dermatitis, an important condition you'll see in clinical practice and one that many patients live with every day. This video is for educational purposes only, not medical advice. My goal is to make this topic clear, practical, and easy to understand. Let's get started. The term stasis refers to stagnation or pooling of blood and fluid due to vein problems. Dermatitis means inflammation of the skin. Put together, stasis dermatitis literally means inflammation of the skin caused by poor circulation. In this lesson, we'll define stasis dermatitis, explain its pathophysiology, recognize the clinical features, and learn how to differentiate it from other conditions. We'll also review diagnosis and management, as well as complications and prevention. Stasis dermatitis, also called venous eczema, is a chronic inflammatory skin condition of the lower legs. It's caused by poor venous return, leading to chronic venous hypertension. Clinically, it presents with swelling, redness, scaling, and pigmentation changes. Pathophysiology of stasis dermatitis. The condition develops because weak or damaged valves allow blood to flow backward, increasing pressure inside the leg veins. This high pressure pushes fluid and proteins into the skin. The leakage triggers inflammation, causing itchiness, redness, and scaling. As red blood cells break down, iron deposits known as hemosiderin stain the skin a brown color. Causes of venous insufficiency. Venous insufficiency happens when the veins can't move blood back to the heart effectively. The most common cause is valve failure, when one-way valves weaken and allow blood to flow backward. Other causes include vein wall damage, prior clots, or deep vein thrombosis, obesity, pregnancy, prolonged standing or sitting, and the natural wear and tear of aging. Epidemiology and risk factors. Stasis dermatitis is fairly common, affecting about 6 to 7% of adults over the age of 50. It occurs more often in women than men. Risk factors include varicose veins, a history of deep vein thrombosis, obesity, pregnancy, prolonged standing or sitting, and older age. Clinical features. Stasis dermatitis usually appears around the medial ankle and lower leg. Key findings include pitting edema, redness, scaling, and itching. Over time, the skin develops brown-red hyperpigmentation, crusting, and sometimes weeping. Severe disease can lead to lipodermatosclerosis, where the leg takes on the shape of an inverted champagne bottle. Stages and progression. The condition progresses in stages. Early disease causes mild swelling, redness, and itching. Chronic disease leads to scaling, hyperpigmentation, and thickened skin. Advanced cases develop lipodermatosclerosis, or atrophy blanche. Complicated cases may progress to ulcers or recurrent infections. Differential diagnosis. Several other conditions can mimic stasis dermatitis. Cellulitis has a sudden onset, is hot, painful, and often affects just one leg. Contact dermatitis has sharp edges and is linked to allergens. Atopic eczema usually begins in childhood and appears in skin folds. Ringworm causes a round rash with a scaly edge, and psoriasis presents as thick, raised patches with silvery white scales. Red flags. Always watch for red flags. Rapid swelling, severe pain, and symptoms that affect only one leg may suggest cellulitis or deep vein thrombosis. Fever or systemic illness, non-healing ulcers, necrosis, or spreading erythema are also warning signs that require urgent evaluation. Diagnosis. The diagnosis is primarily clinical, based on history and exam. Always check pulses to rule out arterial disease. Perform an ankle brachial index test before starting compression therapy. Duplex ultrasound may identify reflux or prior clots. Allergy patch testing can be useful if the rash does not improve with standard care. Complications. If not well managed, stasis dermatitis can lead to complications. These include recurrent cellulitis, chronic venous ulcers, scarring and fibrosis, such as lipodermatosclerosis, and a decreased quality of life due to pain, itching, or cosmetic concerns. Management, skincare. Skincare is important. Daily use of bland emollients, such as petrolatum or moisturizing creams, protects the skin. Topical corticosteroids may be used for acute flares, but they should be applied sparingly and for limited periods, since overuse can lead to skin thinning and atrophy. Patients should avoid irritants like perfumes or harsh soaps, and any infections should be treated promptly. Management. Venous support. Venous support is the foundation of treatment. Patients should elevate their legs above the heart several times a day. Regular walking and exercise help activate the calf pump. Compression is recommended only if the ankle brachial index is greater than 0.8. This can be achieved by wearing graduated stockings. Bandages or wraps are used for severe edema. Lifestyle changes, such as weight loss, are also strongly encouraged. Long-term prevention. Prevention requires daily habits. Encourage skin hydration and protection. Break up long periods of sitting or standing. Maintain a healthy weight and exercise regularly. Avoid tight clothing around the calves and ensure regular follow-up to monitor progress. Patient education. Patient education is critical. Stasis dermatitis is a skin sign of underlying vein disease. Compression and leg elevation are key to long-term control. Teach patients how to apply stockings safely and remind them of infection warning signs such as warmth, pus, or fever. Lifestyle changes like exercise, weight loss, and quitting smoking also improve outcomes. Prognosis. Stasis dermatitis is chronic and often recurrent. Symptoms can be controlled with good care. If untreated, it may lead to ulcers and recurrent cellulitis. With proper treatment, patients can achieve improved comfort and fewer complications. Summary. Stasis dermatitis is inflammation of the skin caused by venous insufficiency. Key features include edema, red-brown discoloration, scaling, and itching. Diagnosis is clinical, but it's essential to rule out arterial disease. Management focuses on skin care, elevation, compression, and lifestyle changes. Prevention depends on consistent, long-term care. If you found this video helpful, don't forget to hit the like button and subscribe to my channel for more medical education content. And leave a comment below to let me know what topic you'd like me to cover next.